Good morning, everyone. Today is Thursday, August 23rd, and thank you so much for joining into our weekly healthcare reform webinars. Pardon me. My name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department at URL. If you are new to this format, questions are definitely encouraged. It helps all of us be better resources to our clients. So there are a couple ways you can ask questions. You can raise your electronic hand icon, which is in the control panel to the right of your screen, or you can type in the question in the question box, and I'll answer that at the end of the webinar. These webinars, believe it or not, we just celebrated our 5th anniversary. We started in August of 2013 running these weekly webinars. It started as a way to really just have all the questions answered at one time and have everybody else, again, ask questions, because at that time, if you recall that time in the ACA, it was very new. Open enrollment through healthcare.gov was beginning, and there were a lot of unanswered questions and a lot of hiccups on the individual side. And then they just continued for this long just because there have been things to talk about. And today is no exception. There's not a lot to talk about, but there is enough to talk about that I appreciate everyone joining in. So just with a show of hands, your electronic hands, if you can see my screen and hear me okay, I'd appreciate it. Great. Thank you all so much. All right, let's get into the agenda. You know, we talked a lot in the last couple of weeks about short-term medical, changing to short-term limited duration insurance. We are really excited about that. I think it's going to be a nice program for those insureds that want to pay less and that are willing to, you know, take on some pre-existing and a little bit more expense as far as what is paid and what is not. So we do see it as an opportunity for the right clients. Pennsylvania is not a fan of these. Our insurance commissioner, Altman, is just not a fan of them. We've had some bad actors in Pennsylvania talking about bundling plans and making their clients think that they were ACA compliant, and then they were hit with some penalties, some tax penalties. So I understand the reluctance, but these do play a part, especially when after October 2nd, they can be sold for 364-day duration, and they're commissionable. So we're excited about that. We think this is a huge opportunity for your onesies and twosies and, you know, or your husband's wife and you know, anyone, again, that's willing to take a little bit of a risk. There is a disclaimer that's going to be broadcast everywhere in the selling of these plans. So just make sure that you are advising your clients correctly and making sure that disclaimer is addressed. So New Jersey waiver for a reinsurance program was approved with bipartisan support. The fund will help insurance carriers pay for the sickest of insureds. If you recall, this was something that President Trump was going to allow as kind of a pilot program. So New Jersey also put in an individual tax penalty, a mandate that really duplicates the national one. So there's about $90 to $100 million that is expected in revenue from the individual mandate, and those funds are going to help in the reinsurance for, again, some of the sickest insureds since, you know, the risk corridors are gone. So anyway, you know, it is what it is. I just thought I'd mention it. 18 attorneys general and health groups are urging the Federal Court of Appeals to revisit the ACA Risk Corridor payments. Obviously, that creates volatility in the rates because the insurers are not really sure, well, they're very sure they're not going to get that additional money. So it does make for instability for 2019, but again, if you're of the mind that this is a monstrous law anyway, it's kind of a means to the end. Unfortunately, some people will be adversely affected, you know, again, unfortunately. So we'll keep watching that. Association health plans, if you are an association or working with an association or know of an association, reach out to me. the carriers are formulating these plans now. There are very specific things that the association needs to provide. They are kind of shaping up. You know, again, I don't think these are the answer to a whole lot of anything, but it is an opportunity. And if you're not talking about it with your clients and those folks you know in an association, somebody else is. So again, reach out to me. There are a lot of things we at URL can do to support those sales, such as our Ben admin systems, onboarding features, et cetera, et cetera. So there's an awful lot that we can do as a team. Just reach out to me. 2019 FFM certification, AHIP and MLMS are the two vendors. They're both available on portal.cms.gov. Highmark also does require an extra step, that certification of ethics, and that is required for on-market sales and off-market sales as well. So Highmark does require that you, even if you're selling off-marketplace, to get the certification, the FFM certification and the ethics certification. That's not been released yet, but should be relatively soon. And of course, I'll pass that on when I get it. Aetna early submission administrative credit of $25 per subscriber. There are a lot of bonuses in your handout. You'll see the white paper bonuses that we put together just as a reminder. Aetna has on the white paper, you'll see the deadlines, and you can get, again, $25 per subscriber administrative credit, plus they still have the $50 per employee up until January of 2019 effective dates. So that's definitely some money that you can earn just by selling as you normally do and being mindful of it. Central Highmark for 2 to 9 has a $120 bonus per group, $240 bonus for the 10 to 50 market, and that's for 7/1 to 12/1 effective dates. UPMC for groups of 2 to 100, you get $200 per contract or more if the incumbent renewal is 5% or less and you still switch to UPMC. We have a URL exclusive Colonial Life bonus that will have first, second, and third place. First place is $250, and that's for 9/1 through 12/31 submissions. This is a huge opportunity. Any of your groups that are 3+ are Colonial reps who are absolutely amazing, Brent and Dina McVicker. They will go out to your group. They do all of the heavy lifting. These guys are amazing, and you sit back and not only offer your groups some additional benefits that they can pick and choose what really meets their needs, but you'll earn extra commission and qualify for the bonus. So be mindful of all of those bonuses going on, because certainly we want to make sure that you get the money that you can. Cat BlueCross, this was just released today. There are problems with the individual commissions, and we know, folks, that they didn't overpay or underpay, excuse me. They probably overpaid. So they are going to be working to correct these commissions. I don't know what that means. I don't know the details. I just know that yet another year with one of the carriers having problems paying individual commissions. So as soon as I know more information on that, I'll let you know the details, but probably not going to end up in the good bucket of things to happen. Upcoming events, again, September 5th, which is coming up very quickly, our Medicare Connections Conference. Register today. It is just about filled, if not filled. So we'll probably be able to squeak you in, but just if you have an interest, it is just a preview of everything that you're going to be selling for your open enrollment period. All the carriers are there giving you a preview of everything that you need to know, have some Q&As and some time to ask questions, one-on-one as well. So definitely worth registering if you are in that market segment. Also, CPHU, Central Pennsylvania Association of Health Underwriters, is having their first Medicare Summit at 7:30 to 5 on the 13th at the Holiday Inn East on Eisenhower Boulevard. It's $49 if you register before the 30th and $59 after. This is the first time they've done it, but it does look like it's shaping up to have some decent speakers as well. So I'd say if you're in that market, you might want to go to both of them because I think both would be beneficial. So that's really it. That brings us up to our open discussion and any questions that you have. While you are formulating those questions, I thank you so much for joining in, and just let you know that next webinar is next Thursday. Also, we will be having some guest speakers the following Thursday on September 6th with Able Pay. There is a flyer as well in the handouts on this webinar talking a little bit about what Able Pay does. In its simplest terms, it is a way for your consumers, your employers, employees to pay for out-of-pocket expenses at a reduced cost as conveniently as possible, whether they want to pay in a lump sum payment or spread it out through 12 months. It benefits the insured. It also encourages higher deductibles, and goodness knows we have a lot of out-of-pocket in today's plans. But it also helps the hospitals, and they're happy to take a cut because their reimbursement per dollar is increased exponentially by these programs. So Lancaster General is going to be more than likely participating by fourth quarter. Right now, it's very big in the Lehigh Valley. And we are going to be promoting it in Central PA because the more folks that sign up, which is absolutely free for the employee, absolutely free for the employer, the more it gets known in our hospital systems here in the central part of the state. And, you know, if they participate, then it's a win-win for everyone. And, you know, another feature is that they review the EOBs for correctness, and they go to battle for any unwarranted charges. So in my opinion, it's a win-win. We've seen a lot of different programs come and go, but I do think it's a very low risk, if at all, any risk program. And I think it's well worth your time to join in on the 6th to learn more about it. So let's open it up for questions. Mike says, short-term medical, the PA Insurance Commissioner's comments still concern me despite I expect the department's approval of products. Can we get a written copy of the advertised disclaimer? Sure. I will get that to you, and Mike says that he's going to sell it, but when he does, he's going to get them to sign the disclaimer, which I do not think is a bad idea, Mike. You know, in this litigious society, you have to kind of protect yourself. Abby says, is the AHIP training for the FFM different from the AHIP we have to do for Medicare? It is indeed, Abby, and there is an additional cost if you go through the FFM training with AHIP. Even though you pay for the Medicare with AHIP, you don't get a discount for paying for the AHIP training through the FFM. The MLMS training is free. If you are a returning agent or broker, there are, I believe, 5 total modules. There's like 2 training modules, 1 test, and then 2 security agreements. So very, very little to do. It doesn't take very long. And like I said, it's free. So that is it. Let's see. Bob, I believe, let's see. Just trying to see. I believe Bob has a question. I'm going to unmute you, Bob. Bob, can you hear us?
Sorry, I had my hand up and I don't have a question.
Oh, okay. Thanks, Bob. All right. Well, that concludes today's webinar. As always, I thank you so much for joining in. I know it's getting to be a busy time, but I appreciate you taking time to, you know, be that resource for your clients. If you have questions, you can certainly always, you know, email me at debw@urlinsgroup.com or give me a call. I'm happy to answer your questions. So right now, I just wish you a great balance of the week and a wonderful weekend. Get out and enjoy the sunny weather. Bye-bye.